My name is Michael Myers, and I am the Clinical Support Manager with Contec Healthcare, and I'm very excited to be here today to be a part of Professionals Cleanovators Day for 2024. A little bit of history about what Contec Healthcare is versus the Contec Professional people you're working with on a daily basis. So Contec Professional focuses on sort of all areas in acute care and hospital settings, but in Contec Healthcare, we're truly focused on the sterile compounding pharmacy. Due to various pharmacy regulations in different states and even federally, there's different ways that you have to clean a compounding pharmacy, different tools, but it's really critical that when EVS is working with pharmacy that there's some communication that takes place so that everyone's on the same page. And that's what Jamie and Daniel and Tom have asked me to come here to talk about with you guys today briefly. Again, so excited to be here. So you just really do need to understand that when you're going in to clean a pharmacy, you may have cleaned operating rooms or isolation rooms, different patient rooms throughout the hospital. You may have even worked in sort of ambulatory surgery centers. And while all that is great and practical, when it comes to cleaning a compounding pharmacy, you're kind of going to have to step back to page one, to stage one of that, and sort of learn from the ground up how you get into that environment. And let's talk about some of the reasons that occurs. So when you're working in a clean room, now right now I am on our clean room set here in Studio 289. So it is not actually a functioning clean room, but this set right here allows us to film training videos that we use to train pharmacy staff as well as EVS staff on the critical ways that you can clean a compounding pharmacy. And it also allows us to bring people in here live to do hands-on training, sort of in a safe space. You know, once pharmacies are up and running, they're really running 24/7, producing safe drugs for patients. So you don't always have the opportunity to get into a hands-on environment and clean. And we certainly have that opportunity here in Studio 289. But just to understand what a clean room is from sort of its most basic level is it's constantly changing the air out through the room. So you would have HEPA supplied air that's going to come in through the ceiling of the room. It's going to sweep out through the room and it'll be taken out on air returns that are going to be placed low down on the wall. And it's going to constantly change the air out in this environment, filtering out any dust and small particles that are in that environment. And then it's going to control the temperature and humidity. That's critical when you're making drugs that are going to be ejected into people's body. People have to wear special PPE, sort of far beyond anything that you may find in any other environment in the hospital. They're going to have to be basically garbed from head to toe in protective equipment. And then the frequency of cleaning and disinfecting is going to be constant when you're in an environment like this. They'll do sort of monthly cleans of ceilings and walls, but their countertops, their floors, those are going to be cleaned daily. They've got things called primary engineering controls, and this is a PEC here in the back of the room. This is sort of where the rubber meets the road. This is where the needle will inject into the vial and the mixing of the drugs will take place. They're going to be constantly disinfecting that throughout the day. As a general rule, when EVS comes into a clean room space like this, that PEC is going to be off limits. If you've been in an operating room, think of it like the anesthesia cart. So this is only pharmacy staff are going to be cleaning this. EVS may be brought in to clean the ceilings and clean the walls, clean the floors, any of those air returns, any of those smaller items like that. So why does this task matter so much? So these engineering controls, this whole room is an engineering control. It's sweeping out all the dust. That primary engineering control is also helping provide protection. Pharmacy technicians are trained on something called aseptic technique. It's literally how they work with their hands and move materials around to ensure that the drugs that eventually are pumped into a patient's veins remain safe. But humans make mistakes, sometimes mechanical machines break down, so engineering controls and pharmacy technicians aren't perfect. And that's why cleaning and disinfecting matters so much. You could have a state-of-the-art clean room that just finished construction with all the top equipment. You could have gone and hired the best doctors, the best pharmacists, the best pharmacy technicians. And if the people who are cleaning that room at the end of the day aren't doing the right job, you really can't have any confidence that that medication is going to be safe. At the end of the day, the people who come in and clean are every bit as important as the nurse that administers that drug or the doctor that prescribes it. So this task of cleaning and disinfecting in the compounding pharmacy is super critical. Again, these drugs are being injected directly into a patient's bloodstream, so they don't have their body's natural defenses. So it's up to us, the cleaning professionals that are taking care of that space. It's up to the pharmacist to make sure they're proper aseptic technique. And then it's up to the director of the pharmacy to make sure that their engineering controls are operating properly, they're monitoring their temperatures and humidity, and that they are training the people who are going in that room. And that's probably the biggest difference when it comes to working in a classified space like this, is there are different sets of rules and regulations that dictated mandated training for folks that come into a space like this. And that's where this collaboration between the pharmacy staff and the EVS staff has to occur, so that anyone who's going up from EVS understands sort of what they're walking into, and that they've completed and documented those training steps that are required by Chapter 797. So let's talk about some different aspects of what this training program is going to have to include. And this applies to anyone who's entering that classified space. So if you're going to be going in and working inside a clean room, even just removing trash or cleaning the floors, there's going to be a protocol that was established by the pharmacy at that particular location, and you need to make sure that you're meeting all those standards. And that's going to include separate training on hand hygiene and garbing. Again, this is going to differ from the process when you're entering an operating room. There's specific procedures that you need to follow when donning and doffing that PPE when you're entering a critical environment like this. So you'll have to get that training on the hand hygiene and garbing. There's going to be different cleaning protocols that you have to follow. When you're cleaning, different sequences. There's going to be sort of different days of the week that you're cleaning different tasks. So you're going to have to be trained on using that. There's different tools, so it's not really the same mops that you're using outside of the other areas of the hospital. They're going to be unique to the pharmacy, and they're going to live in the pharmacy. You're not going to show up with a cart and open the door and clean the pharmacy. You'll just arrive as a human being into that space, and the tools that you need will be there, stored in that clean room for you to use. You'll have to know your dwell times. You'll be using different disinfectants, and that could vary based on the task. If you're cleaning the floors, you might just be using a daily sort of disinfectant. But if you've been assigned to go in and clean the walls during the monthly clean, you're almost always going to be using a sporicidal agent at that point. So it's going to be critical that you understand the different dwell times of the chemistry that you're using, sort of what the task is that's laid out before you, and making sure that you're achieving that dwell time. Again, that's the key, is making sure that we've properly cleaned and disinfected this space so that we aren't causing any harm or injury to patients when they receive their medication. Again, you'll have those special cleaning tools. And one of the most other critical things you'll need to learn is conduct in the clean room. Again, we're in a TV studio, so this actually is not a clean room. Were it a clean room, I would be given lots of red buzzers because I'm not wearing any PPE. I'm just in my scrubs. I don't have on gloves. I don't have on hairnet. So we're obviously sort of violating these rules now. But if it were a clean room, there would be sort of ways I need to conduct myself. We try to limit the amount of time people spend talking in a clean room. Every time you talk, you're projecting particles and actually viruses and bacteria out of your mouth. And even when you're wearing a face mask, they aren't 100% effective in preventing that stuff from sort of flying out the sides of the mask. So we try to have people move slowly in a clean room. As you actually move around fast, your clothing can generate particles and fibers into that task. So as a part of your documented training that's going to be required, anyone who's showing up to that compounding pharmacy has to be trained on conduct in the clean room, proper hand hygiene and garbing. They've got to be trained on the tools, the special tools that they're going to be needed and those dwell times, and then the actual procedure, the cleaning procedures that they need to follow to get that clean room clean. So why does the chapter require all this training? Why does it spend so much time spelling out what's required of these people? The chapters really only establish cleaning frequencies. The chapters tell us how frequently we need to clean the floors and the walls, how frequently we need to clean that primary engineering control that's back there. But the chapter doesn't prescribe how to clean. And that's where each facility is going to develop pretty detailed protocols on the cleaning procedures that they want to follow. And those need to be followed by everyone. At the end of the day, we're asking EVS personnel and pharmacy staff to clean something they can't see. We're cleaning bacteria, things that are smaller than half a micron. The smallest thing we can see with our naked eyes is 40 or 50 microns. So it's a difficult task to look at something and try to clean it when you can't see what you're cleaning. And then from a supervisor's perspective, how can they really come behind and check to make sure that people are doing the right job cleaning it? Well, they can't. You can't look and tell that it's clean. So the only way you're going to know that is to establish detailed, repeatable protocols and procedures that people are going to follow. It's not enough just to write in my procedures, clean the floors once a day, clean the walls once a month. We need to spell out what tools they're using, what chemistry they're using, what the dwell time is. Do I want them to start in the back of the room where the primary engineering controls are located and work their way towards the front where people are walking into the clean room? That would be the right answer. But you need to spell that out, because if employee A comes in and cleans one way on Monday and someone's cleaning an entirely different way on Wednesday, there's no confidence that that room is going to be clean from a state of control, a microbiological state of control in that space. So having this detailed protocol in place is really the only way we're going to know the surface is clean. And that's why this training is so robust and the requirements are so strict in the chapter, because they know anyone going up into that space, we can't just assume because they've cleaned in other areas of the hospital that they're going to be good. We need to train them to the chapter 797 specific aspects of entering that clean room space. Cleaning a clean room we started sort of at the beginning, it's not like cleaning any other space. When you walk into a space like this clean room space, again, we're in a TV studio here, but this is a pretty clean room. So if I assign someone who's never been to a clean room before to walk into this room and clean it, they're going to walk in and say to themselves, well, what do they want me to clean? Because this is the most brilliantly white, sparkling clean space that I've ever been in. You're not really going into that space to clean in our traditional sense of, you're mopping the floor and you hit that mop bucket and the water instantly turns brown, where you sort of get that satisfaction of seeing dirt on a surface and you wipe it up and you've now transferred that debris from the surface onto your wipe. To me, that's pretty satisfying. I know, hey, that's gotten clean. But if I walk into a space that's brilliantly white clean like this, how I really even need to know? So when people go in to clean a clean room, I like to talk to them about the proper clean room mindset, because they can't see what they're cleaning. That's why the training's so critical. So I want them to have what I call a clean room mindset. And I've got an animation that I can show here that'll take that. So Daniel, if you could bring up the full slide. While everyone may not have walked into a clean room to clean a clean room, pretty much everyone has painted a wall at home. So I'm going to take this animation here of painting a wall sequence, and we're just going to sort of draw the correlation between painting a room and cleaning it with disinfectant. Because if I've got a new employee and I tell them, go clean the clean room, again, that room's already clean. What do I need to do? But I want you to go paint the clean room with disinfectant. It's sort of a better visualization of what we're actually doing in that space. We're covering it with disinfectant. So while not everyone has cleaned a clean room, I imagine everyone has painted a wall at some point in their home or apartment. So the first thing I would do if I were going to paint this wall is I would want to do the small stuff first. So instead of a big paint roller, I'd grab a small trim brush. I'd paint beneath the crown molding above the baseboard. I'd want to go paint a square around the thermostat. Maybe there were some light switches in the room. I would go and paint a square around that window. So once I had done my small trim work with that tiny brush, now I can get my big paint roller and start putting paint up on the wall using unidirectional, overlapping strokes. it's pretty critical here that you don't miss a spot. If you miss a spot, you're going to see it. People will painfully see that you missed a spot. So let's go back into the clean room. Instead of a paintbrush, we're going to grab a handheld wipe and do the small stuff first. So we'll clean exit signs, any irregular surfaces on the wall. We'll have to get down on your hands and knees and clean those air returns by hand. You can't just run a mop above those. So we've got our tiny little paintbrush. We're going to clean that light switch. We'll clean that air return by hand, and we'll clean that pass-through by hand. So once I'm done that, now I can get my big paint roller, which is our thick wall mop. And this allows me to start putting paint or disinfectant up on the wall. You don't want to miss a spot with disinfectant. When you miss a spot with painting, yeah, someone's going to see it. But when you miss a spot when you're painting with disinfectant, that then becomes a harbor point that people can use, that people are then going to use for an opportunity for something harmful to grow that could cause harm to a patient. Again, my focus today was to really help you understand the critical importance of communication between pharmacy and EVS staff. I've sort of laid out in broad strokes all the different elements that are required for anyone who's going to enter a classified space like this where drugs are compounded. So that you really do need to reach out. If you're a EVS director, reach out to your counterpart, the leader of the pharmacy staff, and make sure you arrange to have your staff trained. Contec Healthcare has a lot of resources that can help you and your staff with this. We have training videos, we have task sheets. We have a team of what I call Contec Blue Shirt, folks across the country that can come to your facility and help train the pharmacy staff or train EVS staff that are going to be sent up to the pharmacy to clean. So you can reach out to your Contec professional colleague that you're working with and say, hey, I'd like to learn more about pharmacy, and they can connect you to Contec Healthcare. Again, it's been a real pleasure for me today, join you guys today in your Cleanovators journey. And with that, I'm going to hand it back over to Jamie.